Welcome to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the arthroscopic knee exercise program number 2. So if you're viewing this video, then most likely you are about that 7 to 10 day mark, or in your second week after this surgery. Or maybe it's been even longer for you, but your doctor has given you the okay for physical therapy or to start doing exercises, and you have started with program number 1, and now you're ready to move on to number 2. Program number 1, I had said you needed to do for about 7 days, and so hopefully you have gone through that whole program for that length of time. If not, make sure you back up and go through that first, finish that out, and then you can move on to this program. So program number 2. Most likely you are finding that you have a decrease in pain, a decrease in swelling. You can walk more normally now, and your motion is nearing normal. So if you are not feeling those things, it may be that you just need a little bit more time spent with program number 1, and just literally more time for that healing to occur before you move on to this program. But assuming that those things have occurred, you are having less pain, you have better motion, you're maybe even thinking about returning to work if you haven't already, then you need to move on to this program, exercise program number 2. I want to make sure that you continue with the ice and use a bike if you have a bike at home and you've been using a bike. If you weren't able to use the bike that first week just from discomfort, swelling, whatever, then make sure you try and add the bike this week. Also, make sure you're keeping up with medication that your doctor has prescribed for you. And if you are supposed to be going back to see him anytime soon, make sure that you do keep that appointment, get to that appointment so that your doctor can see how you're doing. With this program, I'm going to ask that you continue with the patellar mobilizations, or just moving that kneecap around, and that heel slide exercise from the first program if your motion is not normal yet. So for some of you, for the patients that I've seen over my last 25 years, some of my patients get that motion back within the first week. Sometimes they don't get that back, that full motion back until the second or third week. So just assess where you're at. Compare the motion on your operated leg to the good leg so you can see what normal is. And then you can determine whether you need to keep up with those 2 exercises. So that patellar mobilization and heel slides, you may need to keep those up for yet another week or so. There are just 4 other exercises then that I want you to keep up with for this exercise program. So the first exercise is going to be real familiar. You did it in the first program. But after that, there are 3 new exercises. And that's it. That's really all you should need to get through this next phase after this surgery, and then just get on to doing what you normally do, and hopefully even getting back to some of those things that you haven't been able to do because of this knee pain and problem that you had before surgery. If you have any unusual symptoms, so you have a lot of redness to that knee, it just doesn't seem to be healing, those incisions aren't healing, fever, you just don't feel good, anything that's unusual that you think, I just don't feel good, or this just doesn't seem right, then make sure you give your doctor a call. Your doctor wants to know if something is not going right, I guarantee you. So don't wait, don't hesitate. Just give your doctor a call and let them decide for you whether they need to see you, or they might tell you can just keep going. So make sure you do that if you have any question, or if you think something just doesn't seem right. So that is it that's all I have to tell you for the beginning, or the introduction to this exercise program. So just make sure you view the next 4 videos, and just continue on like you've been doing, and you should be able to get back to doing all those things that you need to do.